All right, so welcome back. So we're talking today about how to treat a vaginal yeast infection. If you joined me with part 1, we've talked about what a yeast infection is, how it looks, and we went through a demonstration showing vaginal creams that can be used to treat vaginal yeast infections. So if you're new here, be sure to catch the first part of this video wherein we talked more about yeast infections and some of the treatment options available. We're going to talk now about a suppository. A suppository is a hardened form of the same antifungal medication that is inserted in the vaginal space. And so this is what this may look like. I'm using this brand, okay? It's an off-brand, doesn't really have a name, but again, the brands doesn't matter as much. You just want to make sure that you're having an azole in your treatment. And so this is a miconazole nitrate vaginal suppository. And this one has a 3 in the name. And so that tells you that this is a 3-day treatment. And so you'll use this medicine at night for 3 nights in a row for you to be completely treated. And so when you open up the pack, so this is what a vaginal yeast infection suppository may look like. It's almost like a little bullet, I would say. But this is the treatment that would be necessary with the antifungal medication. And so whenever you have the suppository option, it also comes with an applicator. And so this applicator came with this product, and it becomes a little bit wider at the top. And the reason is, this is where you will insert the suppository prior to placing it in the vaginal space. So this plunger is a little bit shorter than the cream was. And the reason is because the plunger isn't being filled with medicine the entire time, or the applicator isn't being filled the entire way. It is sitting right at the end or the tip of the applicator. So it's a shorter distance to travel. You would insert this applicator with the suppository at the end, slide it vaginally, and just like before, I'm going to turn this to the side so that you can see it. You're going to insert the applicator all the way until your fingers hit your vulva, and then you're going to press and release just like that and remove your applicator, and the medicine, the antifungal suppository, should be and remain on the inside of the vaginal space. Now, oftentimes in any packaging that has the suppository, you'll also get the option of applying some cream to the outside vulvar region. And it's a smaller tube with a little bit of cream on the inside. And just like we did with the full cream application, you open the tube, you break the seal with the back of the cap, squeeze out some of the cream onto your fingertip. Essentially, you'll take the cream and you'll rub it on the vulvar regions so that you can get relief, which is usually almost immediate, that you'll start to have less itching in the area or irritation. And I would do that liberally. I have a small amount on my finger, but I would truly apply a lot of that cream to the vulvar region so that whatever yeast is in your skin will be destroyed. Now, if you are completely comfortable and happy using these over-the-counter options, know that it's best to use it at night. So take a shower right before you go down to bed. And the reason is gravity can pull things out vaginal space. And so we want you to be in bed laying down with the medicine in the vaginal space and let it sit there for quite some time until you get up to go to the bathroom. And so if you're still running around trying to do things around the house and getting the treatment at the same time, that medicine may not stay inside and not be as active as you'd like it to be. And my other tidbit is, if you do have itching on the outside of the vulva and you're applying the cream to the area, just know that that area may feel fiery for the first few minutes after application. And so that's because the medicine hits the fungus in the skin and causes a little local reaction where it's actually starting to work. And as it's killing the fungus in the area, you feel a little bit of a burning, okay? But that feeling will subside after about 30 to 60 minutes. And again, it's a sign that it's working, so it's a good thing. Now, if you're just like, well, Dr. P, I'd rather not go through a 1, 3, 5, or 7 day treatment where I need to do this repetitively, or you might not be comfortable with placing anything vaginally, or you may have recurrent yeast infections where you're just like, I've treated this a few times and the symptoms keep coming back. Then there is an option of a prescription medication called fluconazole. The brand name for this often too is diflucan. This medicine is a 1 pill treatment that you take by mouth, and it clears your yeast infection. And so if you'd like to get that option, you'll have to see a provider to write a prescription and send it to the pharmacy for you. The medicine works well, just the same as the over-the-counter options. In general, after treatment, your yeast infection should clear in about 7 days. That means after the treatment, even if it's a 1-day treatment, we should anticipate that we'll have continued discharge of the same kind for a few days. If you had itching, you may continue to have some itching. And if you had no symptoms, that nothing should change after the treatment is completed. So how do you prevent these yeast infections from recurring? All right, so here are my tips. So the first is to make sure that the vaginal space does not stay overly moisturized. What does that mean? Well, yes, the vagina should be moist. Yes, you should have discharge. We want these things. However, if we have a lot of external moisture, such as sweating from working out and your underwear is just wet from sweat, that's additional moisture in the area. If you have been swimming and you went swimming, you're having a great beach day, you're on vacation, having a good time, but you've been in your wet swimwear for hours at a time, that could cause a yeast infection. The reason is vaginas are moist, but fungus loves moisture even more. And so when we have additional moisture in the area, it is like the perfect scenario for yeast to grow and multiply. And so that's a yeast infection. It's an overgrowth of yeast and fungus in the area. Now, don't be alarmed that you may have gotten this yeast from somewhere else, because that's not the case. We actually have yeast living in the vagina all the time. It is important for it to be there. It is what is considered to be a normal flora or a normal environment when you have yeast there. But that yeast should be in a certain number. So maybe 50. But if you have more than 50, you have 100 or 150 in the area, that's a yeast infection. And so it just means that you have more than you ought to in the area. And so moisture can help with the reproduction of the yeast and increase the amount that you have there. I hope that makes sense, all right? So now, what else can you do? So you're avoiding moisture, you're keeping your hygiene pretty well. Here are a few other things that you can do. A big one is decreasing the amount of sugar that you have in your diet. Would you believe me when I say that sugar has been linked with yeast infections? And so if you love your lollipops or chocolate and you love your lattes, and every morning we've got to go to Starbucks, those are sugar. If you have a ton of fruits, our bodies are not able to distinguish between the sugar from a soda, the sugar from a fruit, the sugar from a piece of candy. Sugar is sugar. And so if we overwhelm our system, when we tally all of the sugary things we eat per day, if we have an extremely high amount of sugar in our diet, the likelihood of having recurrent infections is pretty high. This is a part of the reason why those who are diabetic may have yeast infections a lot, because they have an overwhelming amount of sugar in their system. We want to have a maximum amount of about 24 or 25 grams of sugar per day. And so you can calculate that by looking at your nutrition label, your nutrition facts, and kind of get an idea of how much sugar you're taking in per day. Take a look and let me know what you find in the comments below. And so one last tip that I'd like to give you today is to not douche. okay? Douching is a process where you purchase a solution from the store and you insert it vaginally to wash out the vaginal space. This used to be a practice that was done pretty routinely across the board, but we've now seen where yeast infections and other infections are more common in those who douche. And so because of that, douching is not recommended. All right, so we've talked about a lot. We talked about treatment. We talked about how to prevent future yeast infections. And now I'd like to just talk about things that you could possibly do to treat a yeast infection that does not include medications. And so these are more natural remedies. And so there are a ton of things that you can probably find online that talks about it. But what we know is that boric acid, which is something you can find over the counter as well, may be able to help treat your yeast infection. We know that coconut oil is also really good at treating yeast infections. Coconut oil actually has antifungal and antimicrobial properties. And so with that, if you're having itching of the vulva, if you're having dryness of the vulva, you can actually rub and insert some coconut oil to the area to help to clear of an infection. Probiotics and yogurt is also another great option. Probiotics have a lot of good cultures and strains of bacteria that can be very helpful in the vaginal space. And so when we have enough good bacteria, it will help to keep the bad or keep our counts right where we want them to be. I hope all this information has been very helpful. It's been a pleasure to kind of demonstrate and show you how to treat vaginal yeast infections. While they're very common, I'd love to know your experience. Drop a comment below. And I'd like to offer you a gift today. We've been talking about all these treatments, but some of the best ways to treat ourselves is to balance our bodies and balance our hormones. And because of that, I'm offering you a free copy of my ebook, Hormones Don't Lie, today. To get your copy, click the link below and I'll send it right off to you. Thank you so much for listening in today. Please like and share. Thank you for being here. Again, I'm Dr. Perkins, and it's been a pleasure talking with you today.